For our assessment, we have the Kohlman's Evaluation of Living Skills, which is the KELS 4th edition. It was historically used for short-term psychiatric units and has now spread to more diverse settings. Currently, the KELS is being used in various settings like acute care, skilled nursing homes, TBI, mental health, transitional housing, and many other areas of occupational therapy. It is used to assess an individual's independence and ability to live on their own across 5 key areas: self-care, safety and health, money management, community mobility and telephone use, and employment and leisure participation. For the purpose of this assignment, we are looking at it in an older population because that is where most of the data was found.
As Landry mentioned, the KELS assessment is used to assess independent living ability and the level of assistance that someone may need. It's a highly regarded assessment due to the variety of populations it can be adapted to serve, and its main function is to score an individual's ability to live independently and safely within the community. Originally, it was designed for psychiatric use, but now is used in various areas of healthcare, including mental health, skilled nursing, transitional housing, TBI, substance use, developmental or cognitive delays, and more. For the purpose of this assignment, we've focused on the research and results of administering the KELS to individuals likely discharging from rehabilitative services or transitioning into skilled nursing or assisted living. And according to the OTPF4, the problem areas addressed are related to occupations, client factors, performance skills, performance patterns, and we are briefly going to go over how we administer the test in the population that we've described. So this is the KELS score sheet, and there's 17 different items. These are scored through observation of the client performance or through self-report. Each skill is rated as either independent, needing assistance, not applicable, or like a further note. Independent and not applicable are worth no points, while needing assistance is worth 1 point. And the last 2 domains of work and leisure are worth half a point each and scored under needing assistance. So a total score of between 6 and 17 means that the client needs assistance to reintegrate into the community, and a score less than 5.5 conveys that the client is able to live independently.
To reiterate, throughout this video demonstration, we will be rotating client-therapist roles and going through each of the domains on the KELS scoring form.
All right, good morning, Landry. I will be giving you an evaluation of living skills. The reason I am giving you this evaluation is to help determine your specific strengths. It will take approximately 30 to 45 minutes. I may be taking notes as the evaluation progresses. If you have any questions, feel free to stop me at any time. And at the end of the evaluation or at another designated time, I will go over the results with you. Are you ready to begin?
Yes.
Okay, so we're gonna start with the reading and writing form. So I just want you to complete this assessment real quick. So please do this. While the client is filling out the reading and writing form, I will be doing the other point of the self-care domain. So the client is considered independent here if no more than one of the conditions under this list is present. Hair is dirty or unkempt, ragged or torn clothing from wear, clothing or shoes is not fastened properly, unpleasant body odor, not consistent with culture, dirty fingernails or ungroomed hands, visible dirt on the body, dirty clothing, obvious dental decay, or open untreated sores. So if the client is unable to fill out the bottom portion of the reading and writing form, you would ask the questions verbally to meet a minimum standard for each of the self-care activities and reach a score of independent. They would have to shower, bathe, or sponge bathe once a week, wash their face once a day, wash their hair once every 7 to 10 days for their appropriate hair type or their culture. They'd have to comb or brush their hair once a day and brush their teeth or dentures once a day.
Now moving on to the safety and health domain. Next, I'm going to show you 4 pictures. There may be a dangerous situation in them, or there may be nothing dangerous at all. Look carefully at each of them. In each picture, you must decide if there's anything dangerous. First, do you see anything dangerous in this photo?
There are multiple cords and one outlet.
What is dangerous about that?
It could cause a fire.
Do you see anything dangerous in this photo?
She is reaching over a pot of boiling water.
What's dangerous about that?
She could catch her robe on fire.
Do you see anything dangerous in this photo?
Yes, there's a cord in between the couch and the corner table.
Tell me more about what's dangerous about that.
It's a trip hazard.
Last one. Do you see anything dangerous in this photo?
Yes, there's a child reaching for pills.
What is dangerous about that?
She could have side effects or anything dangerous for her body size.
Jaimee was considered independent because they identified the dangerous element and why it was dangerous in each of the four photos. Under safety and health, we will go over identification of appropriate actions for health, accidents, and emergencies. Okay, Jaimee, what would you do for yourself if you got sick with a cold?
I would take some cold medicine and I would eat some soup and take some rest.
What would you do if you burned yourself and the wound became infected?
I would put on some Neosporin, and if it became more infected, I would go to urgent care.
What would you do if you suddenly started having severe chest pain and shortness of breath?
I'd be calling 911.
If your house caught on fire, what telephone number would you call for help?
I would call the fire department.
What telephone number would you use to reach the fire department? Since all of Jaimee's answers were appropriate, she would be scored as independent for this category. The third part of safety and health, knowledge of location, medical, and dental facilities, we will ask Jaimee a series of questions. If you needed to see a doctor, where would you go?
I would go to Dr. Sabra's office.
Where is Dr. Sabra's office?
In Covington, Washington.
If you needed dental care, where would you go?
I would visit Dr. Smith.
Where is Dr. Smith's office located?
He's also in Covington.
Jaimee scored independent on this section.
Okay, to save time, we're not going to be demonstrating the money management domain of the KELS. However, there are 3 items that the patients are scored on during this section. The first is use of cash in purchasing items and includes receiving correct amount of change. The second item is paying bills appropriately on time and everything. And it also includes various forms, kind of going over that. Landrey is showing you there. And then the third item they are scored on is obtaining and maintaining an appropriate source of income.
We'll be moving forward to the 4th domain, community, mobility, and telephone. So the first one of that will be mobility within the community. So I will be asking Vannie some questions and she's going to give me some answers. So Vannie, how do you get from one place to another in Yakima?
I drive my car
When was the last time you drove your car?
tonight to meet you.
Okay, thank you. We are moving towards the basic knowledge of public transit system. So, Vannie, do you use any public transportation at this time?
No.
Okay, since Vannie doesn't use public transportation, this is not applicable to her. All right, now we will be moving towards the third portion, use of telephone. So on this I have Chipotle's phone number. I'm gonna pass it here to Vannie, and can you call them and let me know what time they close?
Hello? Yes, I was just wondering what time you guys are closing tonight. Okay, great. Thank you.
What time do they close?
8 o'clock.
Okay, thank you. Vannie demonstrated appropriate skills and is therefore scored as independent in the community, mobility, and telephone portion of the domain.
So using the information we gathered from the money management section, item 3, obtain and maintain source of income, I identified Landrey as client has worked in the past, presently unemployed, but plans to work in the future, and therefore I would ask these questions. When was your last job?
6 months ago.
And what kind of job was it?
Registered behavioral technician.
What kind of job will you look for in the future?
Probably something in healthcare.
Gotcha. And how will you find a job?
Probably send in my resume or use like Indeed or LinkedIn.com.
All right, the second item in the employment and leisure participation category is leisure activity involvement. For this item, I would ask, what do you do in your leisure or free time?
I spend a lot of time hanging out with friends, cooking, working out.
We had appropriate responses for each of the categories here and was therefore scored as independent on both items.
This is our score sheet for our KELS assessment. The client was scored as a 0, which means they are able to live independently in the community.
All right, guys, that was our quick demonstration of the KELS assessment tool. Due to some time restraints and just some alterations, we did skip the money management section, and we altered some of the items within the assessment itself. For example, for the phone, technically the manual says that we should be using a landline, but we altered that just to have a more modern, applicable scenario. If you guys have any further questions, feel free to let myself, Landry, or Jaimee know, or refer to the manual that's in the classroom, or also the in-service form that we will be handing out.